this side of the pelvis tends to go forward and down. And as a result, it drags this top right corner with it. And that tends to be pretty dysfunctional. And the bottom left corner then, by comparison, will tend to become more prominent. We'll see this in our model in a second. And the reason it tends to happen in this kind of diagonal line is because the line of axis is across the joint. This has to do with the shape of the joint. So it does this kind of tipping motion. So what this means is, if we actually look at the model of the sacrum, normal sacral motion, like here we have the back, the posterior surface that we would see, and the anterior surface. In anatomy, anytime we talk about movement of a structure, we always reference it from the front. So this view is going to be particularly relevant. In normal day-to-day motions, a functional action of the sacrum is this kind of tipping action that goes across, really at the level of about S2, or second sacral vertebrae, even though they're fused. So this kind of tipping action happens even when we breathe. This is referred to as, when the top goes forward or moves anteriorly, that's referred to as nutation. As the bottom moves the other way, the bottom moves forward or anteriorly, that's counter nutation. We look at this from the side. So this would be nutation, and this is counter nutation. And that's a functional movement that happens all the time. The dysfunctional movement, we said, goes through this kind of left axis. There is a right axis as well, but because of the nature of the right motor dominance, in most cases when we get a sacral torsion, the right motor dominance and the hip capsule pulls that side of the pelvis forward and the sacrum follows it. So it means this top right corner goes deep, and this bottom left corner, what we call the inferior lateral angle of the sacrum, everything in anatomy has a big long name, but it does describe it, it will become prominent. So if you're a therapist looking at this on the table, this bottom left corner will sometimes look like it's poking up. Okay, so that would be the typical sacral torsion. We would say it's a left rotation like this because the front of the vertebrae is turning to the left, even though it's that right corner going deep. The backward sacral torsion, what we'll have instead, if we keep the same kind of axis, the left rotation axis, this left corner goes deep. So that's a backward sacral torsion.